Hi, I'm Dr. Stonisch, and we're here again for Wellness Wednesday. And the topic for today is how to care for your teeth. And I just thought I would show you what I do on a daily basis to care for my teeth. I use this water pick combination, electric toothbrush and water pick. And the electric toothbrush water pick is nice because it's one unit that sits on my counter. I don't have that much room. And with the electric toothbrush, I like this because it's a 2-minute smart timer. So when I do turn it on, what my goal is really to concentrate on brushing my gums instead of brushing my teeth. And also, because this is battery operated, it's important to know if you push too hard, the bristles will stop moving. So when I'm brushing my teeth, I gently insert the toothbrush and let the toothbrush do the work for me, and slowly move around my mouth. I usually brush the cheek side of my lower teeth. Then, after the 30 seconds, move to the tongue side of my lower teeth, concentrating on keeping the bristles at the gums and not pushing too hard. And then I move to my upper teeth. Pretty simple. You heard it beep once. So I run it for the whole 2 minutes, and I do this at least twice a day. This toothbrush does have 2 modes. You hear this mode, and then a little higher mode. When you first get your toothbrush, you might want to start on the lower mode first, just to get used to the vibration. And then I move on to my water pick. For me, I typically brush my teeth first and then I water pick. When I water pick, I use this water pick, and the reservoir is nice. It comes out, and I fill it with water and put it back in. I like the water pick or some type of similar water irrigation system that has a dial with pressure. This dial specifically measures a pound per square inch of pressure per point here. So you can work your way all the way up to 10, and I encourage you to do that. I'm working at 10 now. It's very important to be able to push the biofilm off the surface of the tooth with the water pressure. So I fill my reservoir up. I like this one because it has an on-off switch for the water. And when I come around, I start in the upper and I stop in between the teeth and spray for 3 seconds. I use a continual spray all the way around my mouth. But once again, I scallop, and in between the teeth, I hold the water pick for 3 seconds. Typically, I'm over the sink and I'm letting the water either pool in my mouth or drain out so as not to make a mess. So I work all the way around 3 seconds at a time between each tooth, and then I come around to my palate, same thing. When I, typically for my upper arch, I use 1 reservoir of water, and for the lower arch, I use a reservoir of water, and I use the 3-second rule. The final thing that I do is that I use a tongue scraper. Absolutely, I use the tongue scraper in the morning because you've been sleeping all night and there's biofilm that builds up on your tongue as well. I use a simple plastic tongue scraper. We give these to all of our patients. You just bend the tongue scraper in half over the sink and scrape on your tongue. There is a buildup, and most oral cancers that are found closer to the back of your throat. And so the further back you can go, the better to remove all of that biofilm and buildup on your tongue. So once again, it's a 1, 2, 3. I use my electric brush for 2 minutes. I use my water pick, and then I use my tongue scraper. So if you do that twice a day, I'm sure that you'll be on the road to a healthy, happy smile. Thanks. Until next Wellness Wednesday, have a great week.